Sir, my son has been asked to undergo adenoidectomy as a surgery. Is it a serious surgery? Does he really have to undergo that surgery? Is it any way different from tonsillectomy? Or is there an alternative to a surgical treatment? Or if this child can be managed without this treatment at all? So there are plenty of questions that would come to a parent's mind. I'm Dr. Karthik Madesh R, Senior Consultant ENT, is going to answer A to Z of all these questions. Now let's first get into what is adenoidectomy. It's been a very old surgery. It has undergone its own evolution, starting from using cold steel instruments to remove the adenoids, to present day technique which involves plasma rays, coblation assisted endoscopic adenoidectomies, where it is almost bloodless and reasonably painless. Now to answer the second question, the difference between adenoidectomy and tonsillectomy, both by nature are lymphoid tissues. By virtue of their location, if it is present behind the nose, it's called adenoids, and if it is present in the oral cavity, it's called the tonsils. Now this adenoid is significant in that sense because it presents itself in the pathway of the nasal airway. Now whether the child will benefit from conservative methods. Yes, to begin with, if the child has first been diagnosed with chronic adenoiditis, the doctor, he or she, would suggest use of nasal sprays to counter it. But after a while, if there are no relief in symptoms, then one has to undergo adenoidectomy. Why, and if not, what? So the question and the answer, I'll try to make it as precise as possible. Number one, the child is going to have sleep-related breathing disorders, which can result in dryness of mouth, foul smell from the mouth, memory lapses, academic underperformance, and also a facial feature change which involves protrusion and overcrowding of the front teeth, the voice change being very nasal in nature. Now all this is going to affect the child's confidence mentally and the child's performance physically. So to avoid this, it is important, if not emergent, to address this problem via a very minimally invasive surgery, which is called as the coblation assisted endoscopic adenoidectomy. Now to throw some more light on what goes into preparing the child for surgery, how long is the hospital stay, and how long is going to be the complete recovery post-surgery. So let me answer it one by one. In terms of preparation, most often the patients who are affected by adenoiditis are of the pediatric age group. So we have to ensure that the child is not presently in a phase of acute infection. This we do with the help of a pediatrician. A referral is taken, and if there was any signs of an infection, the child has to go through a regimen, a small period of antibiotic treatment. When that is done, the child is now ready for surgery. The surgery per se as a duration is nothing more than half an hour to 45 minutes. However, it is important to observe the child for a period of 24 hours to avoid any complications, say for example bleeding post-surgery. The present technique involves advanced rays like a laser ray, which we keep hearing most often than not in surgeries. Now this is a plasma ray where the thermal damage to the tissues around is bare minimal. The wand or the tool which is used to operate in this particular technique has three functions. One, it of course sends the plasma rays which removes the tissue from that place. Two, it also supplies saline wash as it is doing this procedure. Three, it also sucks the remnant tissue to it. So this way the procedure is seamless, bloodless, and post-surgery, most often than not, it is painless. the same evening, so to say, the child can go back to having a regular or a normal diet. Now, the next question is how long the child should be away from school. The period can anywhere vary from 3 to a week's period. But my general advice to all my patients is that a minimum of a week's rest at home will be very beneficial.